Good morning, good afternoon, good evening, wherever you may be in the world. Thank you for joining us on this really important topic today about oral hygiene and dental health. So, back in 2019, Jessica Kingsley Publishers recognised that there was a crisis in terms of dental health and dental hygiene in the senior population in the UK. So they commissioned me to do some research and put together a book about this topic. And what we ended up with at the end of it all was a pocket guide to, it's such a long-winded title, The Pocket Guide to Mouth and Dental Hygiene in Dementia Care, Guidance for Maintaining Good Oral Health. This, we turned it into an advice and suggestions and tips and tricks and all those kind of things. Absolutely crucial tool to have in your armoury, whether you are living with a neurocognitive disorder or not. Get it, read it, follow it. Okay, that wasn't a plug, by the way. That is a really important message. So, what we've learned is that 1 in 10 seniors, now just think about that, 1 in 10 seniors die from aspiration pneumonia. And the reason is due to the build-up of plaque and germs and disease in the mouth, in the teeth, in the gums. So it's absolutely crucial that when we're caring for somebody who is living with a cognitive disorder and we are supporting them with the basic activities of daily living, it is crucial that we make dental care and oral hygiene a priority. One of the problems that has been happening over the years and continues to happen is that if people have a behaviour that challenges and they make it very difficult for you to actually support them in their oral hygiene and dental care, then it gets pushed at the bottom and may be neglected completely. We cannot do that. Please do not do that. Ensure that written in your care plan for supporting that individual is good oral hygiene and dental health. And lots of tips and tricks in the book that I just showed to you. The second thing that I think is really important is a piece of research that the Rory Myers College of Nursing did at NYU. They discovered that people who lose teeth have a much higher increased risk of developing a cognitive disorder or a neurodegenerative disorder. And it appeared that the more tooth loss that person had, the greater the risk was. What they also discovered, interestingly enough, is that people who lose teeth, if they have it addressed quickly and have dentures fitted, for example, then the risks were minimal and not so high. So those are two pieces of information that are really crucial and really important to remember. Now, as usual, I'm here with Lynn. Morning, Lynn.
Good morning.
And I think she has a question for me, but I don't know what it says, so please ask.
Well, define aspiration pneumonia for those who don't know what that means.
Okay, sorry, yeah. Aspiration pneumonia is where we breathe in something into our lung. And of course, it shouldn't be going into our lung. When we swallow, it should be going into our stomach. But it will go into the lung, and that is what leads to pneumonia. And it can happen with anything. Anybody can happen. You know, we often say, we cough, say it's gone down the wrong hole. It might be heading towards the lung, but we cough it up and we cough it out. And then it goes the right way. With aspiration pneumonia, it's where the germ or the piece of material, whatever it is, the bacteria that is built up in the mouth, we swallow it, breathe it in, and it does actually go into the lung. And as we know, with older people, when we get pneumonia, it's not a good thing. So that is why there is such a high mortality rate from aspiration pneumonia in seniors. But that's a very good question. Thank you for asking that, Lynn.
Okay, another question. If someone has dysphagia, is that the trouble swallowing or is that
Speech.
speech? Okay, that's a
So
trouble
if somebody
with speech.
has problems with swallowing,
That's called what?
what is the question?
Well, I'm saying if a person, due to having Parkinson's disease or something else that's going on with them, has trouble swallowing or trouble speaking, are they at a higher risk for having mouth and gum problems and a higher risk for having
Absolutely
other issues?
higher risk of pneumonia, yeah. People who have swallowing difficulties, people who have issues like Parkinson's or later Alzheimer's disease, the later journey of Alzheimer's disease, or other forms of dementia have a greater risk, yeah. And that's why it's so important that if people take medication, immediately afterwards, clean their mouth, brush the teeth, or clean your mouth, brush your teeth. If you're taking medication, afterwards, clean your mouth, brush your teeth. There's a lot of sugar, especially in liquid medicine. You know, there's a lot of sugar to make it palatable. Because if you took medication, liquid medicine, just in its raw form, it would be disgusting. So they put all kinds of things in to make it taste better. And this is even with kids, you know, when we get children who we give medication to. Same thing, get them into the habit of cleaning their mouth and brushing their teeth afterwards. So what I have seen, and many people who are working in the care sector have seen this, is people will be given medication and then, you know, for example, if people are living in a nursing home or on a hospital ward and the drug round, and they will give the medication and then move on to the next person and the next person and the next person. So, but it's absolutely crucial that we ensure, number one, that the person has taken their medication, that they're not left with it drooling or dribbling out of their mouth. And I have seen this, and I'm sure other people have seen this as well. So it's important that we ensure the medication has been taken in the first place, and then the mouth is washed, cleaned, brushed. And in hospice care, that is even more important, to ensure that people who are actively dying, for example, have mouth care regularly throughout the day. So that was another important question. So thank you for asking that, Lynn. What I want to talk about is how do we think, blue sky thinking, when we're supporting people with a neurocognitive disorder and they have a risk of developing aspiration pneumonia, or they refuse dental care, they push you away, they don't want it, they are adamant that you're not going anywhere near their teeth or their mouth. What do we do? How do we manage that? Because these are the complex situations, these are the complex things. So one of the things I want to think about is, how do we overcome a craving for sugar? Now, sugar has a detrimental impact, not just on our physiological health, but also on our brain health. And there could be as much as 32 teaspoonfuls of sugar in one can of soda. So my message to everybody is, kick the soda into touch. Even zero sugar soda, 0 calorie soda. Just forget the soda. Don't do it. Don't drink it. You are, by drinking soda, increasing your risk of developing a neurocognitive disorder, Alzheimer's disease, or other forms of dementia. So that's one of the things I want you to think about. Many people have a sweet tooth. We have been brought up to have a sweet tooth. One of the tricks that the government did in the 60s was to tell people fat is really, really bad for you, really unhealthy. Stay away from fat. And as we were concentrating on that, they were shoving sugar in everything. Sugar was going in absolutely everything. So we've got a generation of people who are hooked on sugar. We're addicted to it. I'm no different. I have a sweet tooth. I love chocolate. I don't drink soda. I've never really been a fan of it. It doesn't, I don't enjoy it. I don't like it. But chocolate, I love chocolate. And I have to have some self-control, and I have to manage myself where that's concerned. A bit of dark chocolate every day is good for you though. So don't think that you can't eat any chocolate at all. So sugar is bad for our brain health, but what does it do to our teeth? I mean, it gets in there and it's bad for your teeth, which is why we must clean and brush and rinse and swill and spit when we have brushed our teeth, when we have had any sugar. Yes, Lynn?
So if you're supporting someone who basically is craving sugar often, and maybe they're underweight, and maybe it's just a way to make the day go smoother, to allow them to have their ice cream 3 times a day if it's necessary. So it's okay to do that and not fight them about it, but maybe find some sugar-free substitutes or some alternatives. But if they are going to have sugar, or basically after any meal or medication, they should be encouraged to rinse their mouth at a minimum as a routine, some kind of routine that you could get in the habit of.
That's a brilliant question and very appropriate, because it just happens that I have a little strategy here for dealing with that. Now, our behaviours, they're kind of built around 3 things. There's a cue, there's a behaviour, and there's a reward. Because we do stuff so that we get a reward. We want a reward at the end of it. So let's think about the sugar. So what is my cue? Identify the cue. I crave sugar. That's my cue. I crave sugar. Okay, I crave sugar. So secondly, what am I going to do about it? I'm going to down a can of soda. Okay, so that's the behaviour. So now we've had the cue, now we've had the behaviour. What about the outcome? What is the outcome? Well, the reward is the outcome, and the reward is my craving has been satisfied. For now, because in an hour's time, it comes back again. So I go through that same process. And however many times a day we go through that 3-stage process is, I guess, depends on the individual. So here's 7 strategies, 7 tips for dealing with that craving. And this is about changing our behaviour there. So the first one is place a note on the fridge door. Something that discourages you from opening that fridge and drinking a can of soda, or opening the cupboard and grabbing a big bar of chocolate. Put something on the fridge door, okay? Something that works for you. Secondly, take control. We have become a nation of people who do not want to take control or responsibility for our own health. We want somebody else to take control and responsibility for our own health. We can't do that. We must take responsibility. We've got to be proactive in reducing our risks of developing all kinds of diseases and disorders, not just neurocognitive. So we have to take control of that. And this is where your blue sky thinking, out of the box thinking has to come in. If you're craving sugar, call somebody, have a conversation with a friend, do something like that, okay? And drink lots of water regularly throughout the day. I mean, this is something we do in Arizona because we know that, we have to do this, otherwise we're going to dehydrate really quickly. But in the UK, not so much. So make sure wherever you live in the world, whether you're in a hot climate, a desert climate like we are, or whether you're in a wet climate like the UK, where I sometimes am, still drink plenty of water. And I think Lynn and the kids experienced our lack of drinking water when we were in the UK last year.
And lack of ice.
And lack of ice. So drink regularly, drink water regularly, because it quenches your thirst, it fills you up, and it distracts you from wanting that sugary drink. And then maybe eat something healthy. So what is healthy? You know, we talked before on one of our videos about the mind diet. So eat something that's relevant to the mind diet. Eat some, I mean, fruit is sugar, but it's in its natural form. So have an apple or have some blueberries. I mean, you know me, I'm a fan of blueberries. I support and encourage people to eat blueberries every day. So have some blueberries and then go and brush your teeth. Because toothpaste, again, toothpaste has been made to taste nice. So toothpaste can handle some of those cravings. Don't go around eating toothpaste. Just brush your teeth and do the usual thing. Okay. Distract yourself by watching something funny. Because when you watch something funny, it releases a whole bunch of chemicals and happy chemicals. So watch something funny. And then finally, focus on an interactive activity. Go do something with somebody, or go swimming, or go into the gym, or play cards, or whatever it is that you might do. Go and interact with somebody and do something like that. Okay, so those 7 tips will help you address a sugar craving. Let me talk about a case now. I've just got enough time to talk a little bit about a case story. So I had a patient who was 92 years of age, and she had a fall, and she snapped one of her front teeth. Now, this lady has spent a lifetime looking glamorous. She was so focused on the way she looked and the way she dressed and the way she presented herself throughout her entire life. And so this for her was a bit of a problem. For her son, it didn't seem to be, because he said to me, "Oh well, she's 92 and she doesn't really, do much, and so it's probably not that big of a problem for her." When I spoke to her, she said, "Oh yeah, this is a problem for me." And what it did for her is it dropped her confidence, her self-confidence, her self-esteem, and she stopped going out and socialising in the community within which she lived. And that is a massive contributor to a rapid decline. So I got them together and we talked about it, and she told him how she felt and how it made her feel not having that teeth. She'd stopped smiling, she'd stopped going out, so she wasn't eating properly, she wasn't drinking properly, she wasn't socialising now, and she was withdrawing into self. No. Let's get her to the dentist and let's get it fixed. And when he heard that and he understood that, then an appointment was made for her at her dentist, and they fixed it. And she pretty much went back to her usual self again. So it isn't just about having a healthy gums and a beautiful smile. It's about all those other things that come with that, the self-esteem, the confidence. And as we're getting older, our story sometimes can be a story of losses in different ways and different shapes and different forms. And so to lose a tooth just adds to that. And of course, may increase cognitive decline, may speed it up. So that is really, really important that we think about the psychological impact that poor dental care and oral hygiene has on an individual. I think one more thing to talk about here in terms of dental care is having poor dental health leads to a whole bunch of physical diseases, and it has a massive impact on heart disease. So having poor oral hygiene can cause heart disease of various types. So that's just one area, and we've talked about the aspiration pneumonia aspect of it. So I want you to really think about those things and think about. There's a case in this book about a guy who would not go to the dentist and whose mouth was appalling. His dental hygiene, he had halitosis, the smelly breath, and he had so much stuff going on, and he refused to go to the dentist. So as a team, we came together and thought of a strategy, and it's in here, and it's really, really good. It's a cool idea, and it all worked out in the end. So there's some good strategies, some good tips and tricks in there. I'm just looking at my little notes here to see if I've missed anything, and I don't think I have. The research I referred to earlier was published in 2021. It was published. So have a look at that, and that's the NYU School of Nursing. Okay. Lynn, do you have anything to ask or add to that?
Well, the link between gum disease and neurocognitive disorders, is it because of the blood-brain barrier? Is it because of the proximity of the mouth, the bloodstream in your mouth running to your brain? Is that why?
Yeah. That's a combination of all of those things, because if you lose a tooth or you have a tooth extracted, there are toxins involved, and some of those toxins can and often do go into the system, and of course your oxygen and your blood goes to your heart, mind, body and soul. So it's in there, and yes, that's the reason.
Is it ever too late to start
No.
taking care of your teeth and gums and doing a better job?
No, start today. Cut down the sugar intake. Brush your teeth after you've eaten. Brush your teeth at least twice a day. Clean your mouth. Make sure you don't swallow when you rinse. Make sure you spit. And so do that a couple of times a day. And especially when you've taken medication. And especially if that medication is liquid form.
And any tips in that book for people that are supporting a loved one?
Yep.
And sometimes people living with dementia don't want to take a shower, much less brush their teeth, much less, how do you get around that? How do you support a person? Because you're coming from a good place, but I'm sure it's frustrating.
Yeah, there are tips in there for dealing with that for caregivers and for the person themselves who are living with a cognitive disorder. The always the important thing is true person-centered care. True person-centered care, which means we meet the person where they are at. We have to understand why people are having an issue with refusing dental treatment, refusing oral care. Why is that happening? What is the underlying cause of that? And that's where you spotlight. That's where, the case I talked about with that lady and the guy. There's a few case studies in here, but the guy who refused all his life to brush his teeth, never mind go to the dentist. There is a spotlighting aspect of that, and that's where you discover, why is this a problem? What is it? And when I'm 58 years old. I know, it's amazing. I don't look it. I know what you're saying, and I know you're saying, is he really? No, he's not. Well,
68.
I am. I'm 58. So when I was a kid, growing up in the little village of Rishton, we had a dentist, and he wasn't very caring, and he was somebody to fear, not somebody to look forward to going to see. And things have changed a lot since then, but that could be a reason for people not wanting to go to the dentist. We don't like pain, we don't want pain, we shy away from pain, So, you know, when we've had a bad experience, just like any other experience in life, we try and shy away from it, don't we? So we've got to find out what the issue is, and that's through a spotlighting, by asking questions, by listening, actively listening and hearing what the person's saying. And then we can talk about this and put together a strategy. And when you've got your strategy, the person is central to that. He or she has to be the team leader, has to be the CEO, and the other people around are, you know, operational support. But the person has to be the central figure. And then there's the action. You take the action, and then you have the outcome. And of course, the outcome, if you followed through with that action and it all goes to plan, which if it's strategically built, there's no reason why it shouldn't all come to plan, and the individual has a better experience and their quality of life has improved, their basic activities of daily living have been addressed and met, and they're in a better place physically and psychologically. And there are strategies and tips in that pocketbook that will help caregivers with that. Yeah.
Okay, very good.
Okay, well, we'll wrap that up. Thank you for following us. Thank you for subscribing to our YouTube channel. When I looked this morning, we were at 205 subscribers. That is brilliant, because that means we are reaching at least 205 people, and those 205 people are sharing this information. So we're reaching out to many, many people around the world. So please, please, please share this YouTube channel. Encourage as many people as you can to subscribe to it so that they can watch all the videos that we've got going on there. And you can find out more about us at the website, drdanielnightingale.com. Please make sure you get this book. It's probably not all that expensive, I don't know, because it was a commission book, so I don't have them. You can get it on Amazon, you can get it from Waterstones, Barnes & Noble, they can all order the book in for you. And please, please, please look after your mouth. And the big message, dump the soda. And that's going to be tagged, my tagline at the end of every video moving forward. Dump the soda. Thank you.